Hey, in this video I want to talk about a question that I've come in, and that's about why elderly patients and non-sporting patients need a pro sport approach more than ever. Hey, Dave O'Sullivan here, and I've had a few questions come in about people that not quite sure if this pro sport approach will work with private practice patients or older patients, etc. Well, I can tell you the first thing that we do in the mentorship in Module 1 is we set expectations with the person, but we get clarity on exactly what the problem is. Because every single person, whether it's a professional athlete or whether it's a 90-year-old, whether it's a 60-year-old, a 40-year-old, 20-year-old, every single person needs to be able to sit. Every person needs to be able to stand, go up and down the stairs, sleep well at night, okay? Squat, lunge, push and pull. That's just daily life. Now we've got a phrase in the mentorship, which is sell them what they want, give them what they need. And most patients want to be able to sit for prolonged periods, stand for prolonged periods without pain, get up and down the stairs, live their life without pain. That's the vast majority of people. Now, the only difference in sport is that they may have to do this stuff at a bit of higher levels of loading and higher speed. That's it. But once you understand that this isn't about a diagnosis, this isn't about a rehab exercise, this is about a person, then everything changes. So for me in the clinic here, we're called Pro Sport Physio. The vast majority of our patients, they're actually not sporting patients. I'll get some professional athletes come through here, but the vast majority of patients that I'll see in the clinic when I'm not working with teams is non-sporting patients. And I'll be honest, they're actually the patients I enjoy working with most. I get a lot more, I suppose, satisfaction from helping someone who's had persistent pain for 5-6 years, who has given up hope, and actually help them get their life back again. That to me is much more rewarding than helping a professional athlete, if I'm being completely honest with you. So what do we do when the person comes in? In the Module 1, in the subjective assessment, we get really clear on what problems the patient has. And again, they're going to be the usual stuff. Oh, I can't sit for a long period of time without pain. Every time I stand up, I feel stiff, I feel rigid. When I go to bend down, I need I want to be able to do this, I want to be able to do the gardening. And once you start looking at the person, you can see, okay, here's the problem, and this is where I need to get them back to. So what we do in the mentorship is we use what I've been taught in pro sport, which is to go, right, here's the problem, this is what's causing the problem, so that we make sure that doesn't come back again. Because in professional sport, you have to make sure that when you put the athlete back, they're ready to go back, but also that they ultimately don't break down again. So what we need to know is what's causing this, or what's contributing to this. The other thing we need to do in pro sport is we need to give the patient some kind of guidance on how long it's going to take and what's going to happen in order for them to get back. And then the most important thing is we need that period of resilience. Now, pro sport athletes are used to it, non-sporting patients aren't. So how do we address that? That once that pain eases, there's still a little bit of work to do to actually build that resilience to get that last 20%. And that's what we do in the mentorship in effective communication. So at the end of the subjective assessment, we're really clear on what the patient wants to get back to, what they need to be able to do. The objective assessment, we're making sense of their symptoms and what's the problem that's ultimately stopping them getting back. And then the next bit we do is we actually communicate the problem and the solution. And what I'll do, just like we do in pro sport, is I would draw out the progressions for the patient. Okay, so this is where you want to get back gardening. This is where you want to get back into the gym, walking, whatever it is. Okay, this is how hard your muscles have to work. Again, I keep this really simple. I keep this, we do this in a very structured way in the mentorship. Okay, so this is what we need to do ultimately. So if that person wants to be able to sit for prolonged periods, they need to be able to relax their back. They need to be able to depress the rib cage, stretch their diaphragm. They need to be able to ultimately relax, okay? If a professional athlete wanted to be able to bend down, they need to be able to do this exact same thing mechanically, but they need to be able to do it a little bit faster speed. That's it. That's the only difference, okay? When someone goes to sit to stand, that's essentially a squat. If someone gets out of a car, it's a squat, but it's in a different plane. That's it. A sit to stand is ultimately a squat. You can call it a split squat or something like that. In the mentorship, we coach the 6 hours versus 6 reps. Most people are focused on this. In the mentorship in modules 2, 3, 4, and 5 especially, we'll go, right, what are the 6 hours? And again, we're going to identify that in module 1 in the subjective. What are the opportunities to practice throughout the day for the patient? Whereas in sport, we might be getting this stuff in warm-ups and stuff like that, but it's even easier to do this stuff during the day because people have opportunities to practice. So again, every time you go up and down the stairs, every time you get up off the chair, every time you sit down, this is opportunities to practice this stuff to get you from here to here. And that's what we focus on in the mentorship. So it's not about these high-level exercises. And I'll be honest with you, by the time we get to here, okay, even with pro athletes, a lot of what we're going to do, and a lot of pro athletes come to me here and they've gone through all the strengthening exercises, they've tried all this stuff, but they haven't got the foundations in place. By the time you get to there, what I'm doing here is pretty much the same, whether it's a professional athlete or whether it's a private practice patient. And it's just getting them tolerate load again through areas of the body, undoing these movement habits that they maybe developed, maybe because of pain or as a result of pain, who knows, doesn't really matter. We still need to undo them and give them back an opportunity to get everything doing its job again. And that's all we're trying to do with the person. We're not trying to do anything special. We're trying to give them back what they once had. And we're trying to do that so that everything does its job. And as I said, when you want to get that rib cage moving, when you want to get the lower limb to tolerate load, when you want to get the hand to tolerate load, it's the exact same thing for a professional athlete as it is a non-sport patient. And the reason that is because we're so clear on what the problems they have and what we're trying to get them back to. Most people are focusing on the low back and they forget the problems that that person has every single day. If you get clear on that, you get clear on the 6 to 10 hours rather than 6 reps, then your adherence, your results, your progress, you're going to be pleasantly surprised. So the sooner that we get this into private practice, the sooner you give your patient clarity, the sooner you identify and you do a needs analysis of the patient of what they actually need to be able to do, that they want to be able to do, not what you think they need to be able to do, okay? You find the problems that's causing it, you give them a realistic expectation, you set expectations for your patient of how long it's going to take, okay? And when the pain goes down, there's that period where they're going to have to build that resilience. So just because the pain eases doesn't mean they're done. That is what the vast majority of patients need in here, okay? And you can go, oh, I don't know if this will work for my patients. It's a human being. We have done this, got well over 5,000 patients that have come through that door, okay? And we've done this, we do this day in, day out. It's being done right now in the clinic. Initial assessments, patient comes in, what's your problems? Objective assessment, identify the obstacles for that patient. Where do you want to get back to? Right, sit back down, let's explain the problem, let's explain the solution, which will be the treatment plan. This is how we're going to do it. Have you got any questions? Then all of this stuff about, oh, they just want hands-on treatment, all of this, it becomes irrelevant. Okay? It doesn't matter if it's a 90-year-old or if it's a 20-year-old, we go through the same process because ultimately it starts at what that person needs. It's not about lying a patient on their back and doing these high-level exercises. We keep things simple. We focus on the 6 hours a day versus the 6 reps a day. And we do that also with professional athletes. Okay, professional athletes will need a couple of little bits, but you want to know that that's modules 10 and modules 9 and 10. Modules 1 to 5, and then modules 7 and 8, that's going to get you everything you need for a non-sporting patient. If you want the high-level stuff for the professional athletes, and there will be some patients, field sport athletes that you will need to differentiate yourself, that's where you're going to use your modules 10 or 9, 10, 11. Module 12 in the mentorship is in here, it's in the gym, building resilience. Every patient needs to be able to squat down to the toilet. Every patient needs to be able to get out of a car off center, split squat, pick something up, load a dishwasher, reach for something, pull for something, push something. That is all stuff that just because there's a weight in the hand, it doesn't matter. The principles are the same. We want good movement options, we want everything to do its job. So the sooner you stop thinking about exercises, the 6 reps, you start focusing on the person, then it doesn't matter if it's a professional athlete coming through your door, if it's a non-sporting patient, because you're so focused on X, Y, and Z, and your treatment plan is focused on X, Y, and Z, and you're focused on the opportunities to practice throughout the day, then it doesn't matter. So if you want help with this, if you want to see in your situation how you can get this stuff implemented very quickly, click on the button below, book a strategy call session. There'll be absolutely no obligation, there'll be no hard selling, okay? I don't know if we're going to be a good fit for you. I don't know if you're a good fit for us. I'll be honest, we don't work with everybody. There's certain people who do very well with this stuff. There's some people that, you know, you can bring them you can pull a horse to water, but you can't make them drink it. And for me, I'm not interested in, you know, begging people to do this. You either want help with this or you don't want help with it. As I said, there'll be no hard selling. If you feel you're a good fit, we'll give you all the details. If you're not a good fit, we'll politely say, we don't think this is right for you, but we'll direct you where we think maybe you benefit from next. If you're not ready for the mentorship, that's absolutely fine too. We'll give you the next steps, or we'll help you get ready for the mentorship. So click on the button below. I'll see you on the next video.